Understanding implantation bleeding.
Hello viewers. Today, we're going to talk about a common question many women ask during the early stages of pregnancy. Will I experience implantation bleeding if I'm pregnant? Let's break it down.
What is implantation bleeding?
Implantation bleeding is a small amount of spotting or bleeding that some women experience after the fertilized egg attaches itself to the lining of the uterus. This happens about 6 to 12 days after ovulation. It's one of the earliest signs of pregnancy for some women but is not experienced by all.
How common is implantation bleeding?
Not every woman will experience implantation bleeding. Studies suggest that about 20 to 30% of women might experience this kind of spotting. It's also worth noting that not every spotting or bleeding during the early stages of pregnancy is due to implantation. There can be other causes of early pregnancy bleeding.
How to differentiate implantation bleeding from menstrual bleeding?
1. Duration. Implantation bleeding usually lasts for a short period, typically a few hours to a few days. It is generally not as long-lasting as a regular period. 2. Color. The blood from implantation bleeding can be pinkish, reddish, or even brownish. It is often lighter in color compared to menstrual blood. 3. Flow. The flow of implantation bleeding is very light. It's not like the flow of a regular period. 4. Timing. Implantation bleeding happens a few days before the expected date of your next period. In summary, while implantation bleeding can be a sign of pregnancy, not every woman will experience it. It's always a good idea to consult with a healthcare professional if you have any concerns or questions about bleeding during early pregnancy. We hope this video has shed some light on the topic for you. Stay informed and take care.